Last week, we spoke with functional medical specialist Dr. Will Cole, and he gave us some advice on how to better our chances against COVID-19. This week, he's going to demystify inflammation. You've probably heard of it before, but he's going to tell us why it's important to manage all of the time for your health, but especially now. We've talked about inflammation on our show in the past, and we've had it defined as something that's natural, and that, yes, you need some inflammation to be able to heal wounds and sorts. So we've tried to demystify what that word means as much as we can, but I'd like to get a nice definition from you, since you have written a book called The Inflammation Spectrum.
Inflammation, you're right. It is a nebulous term for many people. Like, what the heck is it? What are we talking about? It is a product or a manifestation of the immune system. So as you had said, it is in balance. It's actually an important part of human health. It fights viruses. It kills bacteria. It heals wounds. Inflammation, when it's balanced, is actually essential for human health. It's when inflammation is thrown out of balance when problems arise. It's chronic inflammation is the typical term that's being referred to. It's chronic inflammation. It's like this forest fire burning in perpetuity. That's an issue. Right. It's out of balance. It's a lack of homeostasis. It's the Goldilocks principle, right? Not too high, not too low, but just right, and just right when we need it. So when things like a virus comes, you want inflammation to come up, but then come down, not causing this sort of chronic inflammatory response, which can really be negatively impacting some people. It is something that I really spend my time looking at what is driving people's inflammation levels, and to help lowering and balancing that so they can feel like themselves again.
You hear about anti-inflammatories and, eat this food or have this supplement because it's anti-inflammatory. You need to get more omega-3s. Is it only going to be helpful if you solve some other cause?
There's a lot of free or low cost content for people to lean into it. So start there. It depends on how complex the case is. Sometimes you're right. It is really, really beneficial to have someone outside of yourself to guide you and look at what's needed for you, because there's a lot of oftentimes conflicting information out there online, etc. So to really fine tune it, there's definitely, it's really helpful for people that are disillusioned as to what's right for them. But I love what you're putting out there, and things like health books are really a good starting place for people. I think this is a really great conversation. I think for people to start having agency over their health, many people are disillusioned. There's a lot of, again, conflicting information in media, and I think it's great that you're providing good, solid, evidence-based information for people to equip themselves with the best that they can, with the access that they have. I'm excited to be on today.
Yes, and thank you for being here. Like we say all the time, we want people to be their own best advocate. And if you're advised to do something, you try it and you're like, oof, I don't know, something's not feeling right. And go back and be like, hey, something's not feeling right. And if you get somebody that's pushing you too much and not saying, oh, well, let's reassess, then we think that that's something that you should reassess, because we want people to be healthy, happy, and to continue living their longest, happiest life as long as they can. So.
That's great.
Well, thank you so much for being on with us today. We really appreciate it.
Thank you.